Hey everyone, Dr. Mika here again. If you're new on this channel, welcome. Please click on the subscribe button if you have not already done that. Turn on your bell notification so that anytime I drop new videos, you will be notified. Like and share this video. Please don't forget to subscribe and follow me on my YouTube channel, on my TikTok accounts, on Instagram, even on Facebook. Follow all my accounts. Now, before we get started, what is encephalitis? Encephalitis is a condition where the brain parenchyma is inflamed. So it simply means that it involves the inflammation of the brain tissue itself. What is the word encephal? Now, from the Greek word, the word encephal simply means brain. So encephal is the brain, and the litis is the inflammation. So when you hear encephalitis, it simply means, in a simple term, inflammation of the brain. Okay. Now, but what could make the brain to be inflamed? Now, the brain doesn't just get inflamed on its own. Something will happen. Okay, there will be some pathological changes that will not get the brain to be inflamed. So this usually is caused by virus. Now there are several viruses that can get the brain to be inflamed, or the brain parenchyma, or the brain tissue to be inflamed. Now the most commonest viral or virus rather that can get the brain to be inflamed is the HSV virus. The HSV is the herpes simplex virus. That is the most commonest virus that can get the brain to be inflamed. So this type of infection, if anyone has it, the brain will sure be inflamed. And then, of course, there are other things that will come. But before we go into the signs and symptoms, okay, let's talk about the different types of viruses that can get the brain inflamed. Okay, so for anyone to have encephalitis, it is there's a virus that is involved in it. So the HSV virus, the West Nile virus, the Epstein-Barr virus, okay, these viruses can make the brain to be inflamed. In fact, there are other viruses like the rabies, the St. Louis virus, and the equina viruses. All these viruses can get the brain tissue, to be inflamed. And then there are other signs and symptoms that the patient will exhibit. Now, there are other infective organisms and conditions that can lead to encephalitis, you know, like the protozoans or what is known as toxoplasmosis can lead to encephalitis. Metabolic condition can also lead to encephalitis. Patient with autoimmune disease, okay, like patient who have this anti-NMDA receptor encephalitis or lupus encephalitis. These patients are at risk of having uh, encephalitis. Now, let's look at the epidemiology and also the factors, risk factors that can affect patient who develop encephalitis. Now, patient young patient generally and the older patient, elderly patient, are at risk of having encephalitis. So they are at both extreme end. You can barely see patients who are in their middle 40s or 50s having encephalitis. Okay, no, not necessarily, except if there are other factors that can lead to that, which I will also tell you in this video. But generally, epidemiologically, patients who develop encephalitis are either younger patients or older patients. Do you understand? Elderly people or younger patients. These are patients who can develop this encephalitis mostly. Now, there are other risk factors that can actually lead to anyone having this encephalitis. Now, the condition could be for those patients who are immunocompromised, patients that have HIV and AIDS positive, they are at risk of having encephalitis, viral encephalitis. Patients who have benefited from something like organ transplantation, any form of organ transplant, those kind of patients are at risk of having viral encephalitis or even general infection. So encephalitis itself, like I said to you, it's a viral infection. So anyone can have it, especially those who have low immune system. Another risk factor of getting encephalitis is when you're exposed to an infective vector in an endemic area. Say, for instance, you travel to a country that is It's endemic with mosquitoes that carries West Nile virus or dengue virus. If you are in those areas, you are at risk of getting exposed to encephalitis. Now, the purpose of this video is to discuss the signs and the particular signs and symptoms that a patient who has this encephalitis would exhibit. Let's look at the early prodrome signs and symptoms. Now, patient who has viral encephalitis usually have an early signs of headache. Headache. Now, this headache is not the usual headache. When they come to you, they tell you, "Oh, doctor, I'm feeling sensational headache that is not normal." They don't know any other description because it's quite difficult for them to describe it. So they'll tell you, "Oh, it's a headache that is not normal like the normal headache." So perhaps they've taken like analgesia and all that, and it's not helping the headache. So you know what happened to those kind of patients? What happened is that their brain is inflamed and swollen. So there's a pain receptor activator that has been activated. The pain receptor activator has been activated because obviously the brain is swollen, it's inflamed. Remember, I told you from the beginning of the video is that encephalitis is inflammation of the brain. When the brain is inflamed, that is encephalitis. So in this kind of patient, their brain is swollen and inflamed, and then the pain receptor activator has been activated because that is how they feel that kind of sensational headache, which they describe to you and say, "Oh, I feel this headache, doctor, but it's not a normal headache." Yes. Program sign for these patients with encephalitis is that they'll become myalgia. They have myalgia. They'll complain to you. They say that they have general muscle ache. They start complaining of general muscle ache because and pain because of the brain that is inflamed. Okay. That is not the only thing. They have malaise. Malaise is mean generally when someone is feeling unwell. So they generally start feeling unwell. These patients are patients that acutely get ill. Within hours to days, you need to really monitor them because they acutely get unwell and they develop spiking fever that is more than 39 degrees Celsius or more than 100 Fahrenheit by oral recording. Why? Because the brain is inflamed. The brain tissue is inflamed and swollen, and so we make the patient to be generally unwell. They'll be very, very sick. So they are patients you need to really monitor and watch out for. Now, another thing you need to notice about patients with encephalitis is that they develop altered mental status. These patients have problem concentrating. They have problem with alertness. They have decreased alertness, decreased level of consciousness. They are confused. They don't know their surroundings. They don't know where they are. They have behavioral changes. If you take a patient with encephalitis to the hospital and ask the patient, "Where are you?" He or she may probably say, "Oh, I'm in the supermarket." Meanwhile, they are in the hospital. So it affects their lifestyle. And you know why they're experiencing this? Because the brain is inflamed and swollen. So it affects their mental status. You understand? They have altered levels, altered sensorium. So patient with encephalitis, you need to know that they will have altered mental status. They will tell you they have headache. You sure see that headache. The headache, they will tell you they don't know that it's not normal headache. They'll have spike in fever. They will develop myalgia, general body aches. They'll have malaise. They generally feeling unwell. Another thing you'll notice with patients with encephalitis is that they'll start hallucinating. There'll be memory problems. There'll be mood swing. Okay, the family member will notice that there's a change in the behavior of the patient. So there will be personality changes. So patient will become confused. They no longer even remember their names, their date of birth. They don't remember where they are. They no longer remember anything because there will be decline in the memory. So, in fact, especially if it's a viral herpes simplex virus, because that HSV affect the temporal lobe and of course the frontal lobe as well. And this area of the brain helps in functioning of our memory. Okay, it helps the memory functioning. If HSV, the viral herpes simplex virus, affect those area of the brain, there will be memory deficit. Okay, there will be memory deficit, and there'll be slight changes in the clinical features of the patient. So, depending on which of the virus that affects the brain, Okay, but for HSV, herpes simplex virus, for sure there will be memory decline. Okay, in fact, sometimes it can lead to seizures. A patient will develop seizures that can lead to coma. So for coma, it's one of the things you will see as a complication in patients with herpes simplex virus. So all this is happening because the brain is inflamed and swollen. Okay, as this happen, there will be increased pressure in the brain. There will be increased intracranial pressure. Okay, because the brain is swollen, it will get to a point there will be no space where it will get swelled to in the brain. So there will be pressure in the brain, which will be very, very high, increased pressure in the brain. And this might lead to a variety of other things. Like, for instance, patient will start developing seizures and then it will lead to coma. There is also focal neurological problems that the patient might develop because the brain is inflamed. Depending on which part of the brain is affected, if, for instance, it affects the frontal part, the frontal lobe of the brain, it will affect the way the patient behaves. So the patient behavior will change. They will have personality changes. Okay. Now, if it affects the area of the brain called the brocal area or the winical area, now, the patient will become aphasic. Why? Because those areas is the speech language area. So any inflammation in that area would affect the speech. Patient will not be able to speak. They will become aphasic. Or they have dysarthria, or they will have problem understanding language. So if you speak to the patient might keep murmuring one particular thing. If you say, for instance, "What is your name?" They'll say, "What is your name?" You understand? It's because of that inflammation of that area of the brain, the broca area or the Wernicke area. Those are the areas that control the speech. So if it affect that area of the brain, the patient will become aphasic, dysarthric, or they have problem or trouble understanding language. If it affect the motor or sensory cortex area, there will be problem in moving the limbs, either the arms or the legs. So those are the things that you see in patients with encephalitis. Now, these are very similar with those you see with patients with stroke. Patients with stroke also have this focal neurological deficit. But for patient who has encephalitis, they will surely develop this focal neurological deficit. You will sure see it with them. Problem speaking, problem understanding languages, trouble with the limbs, these are things that they have. They develop focal neurological deficit. They can have seizures that might probably lead to coma. Another finding that may occur, depending on the effective etiology that leads to the encephalitis, the case of herpes simplex virus, there may be a reactivation of herpes simplex virus, leading to retrograde transmission to the brain, causing encephalitis. So, therefore, you see a vesicle on the mouth of the patient or on the lips. Another thing you will notice is that you see inflammation of the lymph nodes. There will be lymphadenopathy. Okay, patient might develop splenomegaly, so there will be enlarged spleen due to what? Due to inflammation of the spleen. Okay, so there's also another thing I want you to note, that you will see that patient have inflammation of the meninge. The meningeal layer is a layer that covers the brain, that wraps the brain. There's a layer that wraps up the brain. That layer is called meningeal layer. Now, if there's inflammation of that layer, patient will develop meningitis for sure. However, remember that encephalitis is inflammation of the brain. So there can be two things in this kind of patient. Patient will develop encephalitis, which is inflammation of the brain, and also inflammation of the meninges. So you can have meningoencephalitis. So patient might have two things. So when there's inflammation of the meningeal layer, patient will develop meningitis for sure. So one of the symptoms that may occur if the meninge is involved is that there'll be nocturnal rigidity, there'll be stiff neck, okay, stiff and painful neck. It will be difficult to flex, the neck. There'll be rigidity of the neck, and patient will complain of pain. You understand? They'll have clinic signs. They have photophobia, phonophobia. They have nausea, vomiting. They have pressure in the meninge. Okay, these are signs that you see with patients who have inflammation of the meninges. Hope you enjoyed this video. If you do, please don't forget to subscribe. Share this video to your loved ones. Like and share. Subscribe. See you in my next video. Thank you for watching. Atutale.